People in northern Sydney live on average 9 years longer than those in remote northern Australia. Distance, poor access and lower socioeconomic standards mean there's a huge gap in the quality of services for those living in rural and regional areas, particularly Indigenous Australians. Remote health specialists say one solution is training more Aboriginal health workers. Catherine Gregory reports.
Agnes Page is able to help lead this welcome to country in Nayu on the Daly River, thanks to getting dialysis treatment in her own community.
I found that when I was in Darwin, it's like you've been closed in there, and when you're out here in the bush, you go out hunting and do all these sort of things.
She's one of the lucky ones. 1 in 5 Aboriginal adults have chronic kidney disease. Rates are higher in remote areas where treatment is often unavailable.
You have not only the challenges with access to healthcare, but also a greater burden of the social determinants of health. And so these all add up together to provide a much higher chronic disease mortality in very remote areas.
Remote health experts from all over Australia are in the Territory for a national conference, hoping to find solutions to closing the life expectancy and chronic disease gaps. They toured the Nayu Clinic, one of the Territory's better.
If you look at the amount of money that's spent in the primary health field for the east coast of Australia, you know, it would be almost magical if the remote and isolated areas of Australia managed to get 1/5 of that.
Remote and rural health workers and even some of the patients say that prevention is the best way to plug the gap. And in communities like this, they want to see the Aboriginal health practitioners take the lead. Agnes Page says those workers have guided her to healthier living.
If this thing can happen, like get me going, it can be better for them other patients.
2, 3.
The Bachelor Institute near Darwin trains Aboriginal health workers.
If you're getting local people trained up, they're going to stay in their local community.
The challenge is equipping more local people with the specialist health skills needed to take control of providing healthcare in their communities. Catherine Gregory, ABC News, Darwin.
The federal government has announced it will start redirecting doctor subsidy payments from regional towns to smaller, more remote areas of Australia. $50 million from the General Practice Rural Incentive Payment Scheme will now be allocated to try to attract more doctors into communities with less than 50,000 residents. It means doctors in remote communities with less than 5,000 people could get up to $60,000 in subsidies.
What we've done is recognise that we need the right doctors with the right skills going to the right places, and an incentive program should do exactly that, provide incentive to those doctors to get them to those areas of need.
The government says 450 rural and remote towns will get more money under the revised scheme. And our reporter Catherine Gregory spoke to the Executive Director of the National Rural Health Alliance, Gordon Gregory, about what this announcement means for rural and remote health.
Thanks for joining us today, Gordon Gregory. Firstly, what's your reaction to the government's announcement? Do you think it's enough to reduce the gap?
Well, look, it will help, but it's not actually a large new program. What's happening is that the available money is being redirected so that a greater proportion of it goes to the small places rather than the large one. This has been in the pipeline for over a year, and it is good news. It will help the smaller places, but I say again, it's not a new program.
What about the other health workers that are needed to be attracted to the bush, and what other needs are there in the bush at the moment besides ones for doctors?
Well, that's a very good question, because of course we want the whole of the health team to be available to people in more remote areas. That's really the gist of this conference here in Darwin this week. That is to make sure that governments are aware of the need to have not just doctors, who are critical, but also every other allied health professional, nurse, dentist, pharmacist available to country people as well.
What proportion or level of funding do you think is needed to make that happen?
Well, look, I mean, how long is a piece of string? I mean, we'd love a big program, but it's very unlikely in the current fiscal circumstances. So I think what we've got to do is persuade governments that there are good ways to do things, to deliver services, for instance through telehealth, for instance through outreach programs, through supporting the flying doctor. There are things that can be done which are not particularly expensive, may not be all that new, but it's one step at a time. You know, we're not going to solve the workforce problem at a single stroke, and certainly not this year.
Now, this program doesn't have any specific target for Indigenous communities. Do you think they're going to be missing out at this stage?
Indigenous communities, as you imply in your question, miss out on all sorts of things, and this is, you know, much to Australia's shame. So the Rural Health Alliance, which I work, which is interested in all of non-metropolitan Australia, is obviously critically concerned with the health status of Aboriginal and Torres Strait Islander people, because 70% of them live outside of the capital cities. So if you're concerned with rural health, as we are, then you've got to be concerned with improving Indigenous health, and it's proving very difficult to fix.
One thing that remote health workers have flagged is the need for more Aboriginal health practitioners in communities, and also the need to train them up more efficiently. This program isn't necessarily targeted at that. What do you want to see the federal government do to make that happen?
Well, again, it's a good point, because in many remote places the most highly qualified health professional is not a medical person. There is no resident doctor, and so you turn to remote area nurses and Aboriginal health workers, as you say, and so it would only be fair that there are equal or equivalent programs for them to encourage them to relocate and to stay. Where the Aboriginal health worker workforce is concerned, I mean, it's becoming much more accepted that they fulfil a critical role in remote communities. So I think our understanding of the use of Aboriginal health workers, their value, the great service they do, is growing, and this will hopefully lead the government, state and federal, eventually to have equivalent programs for them as there are currently for doctors.
Thanks very much for your time today, Gordon Gregory.
You're very welcome.